It's 6 o'clock on Friday, the 26th of August. Good morning. This is Today with John Humphreys and Michelle Hussein.
The news headlines this morning. Plans are being drawn up that could see big cuts to NHS services across England. Today's newsreader is Neil Sleet.
NHS services across England could be dramatically cut as part of wide-ranging efficiency plans seen by the BBC. The proposals include cuts to bed numbers and changes to the care provided by GPs and A&E departments. NHS England says no changes will be made without local consultation. Here's our health editor, Hugh Pym.
NHS England says a reorganisation of local services is essential to improve patient care and help find billions of pounds of required efficiency savings. But the think tank the Nuffield Trust has warned that some areas are proposing cuts of up to 20% of beds in what are said to be large-scale reconfigurations of services. Examples include proposals to reduce 3 hospitals to 2 and reviewing GP practices in Leicestershire and Rutland, and the possible closure of a major A&E department in one area of the West Midlands.
28 minutes to 8. So there are going to be real cuts to NHS services. We knew it was inevitable given the need to try to stop costs rising even more than they have been, but now we're getting a slightly clearer picture of what it will mean in practical terms. The think tank the Nuffield Trust has warned that in some areas hospitals will be closed, in others there will be fewer GP services. The campaigning organisation 38 Degrees says we need to know more. There hasn't been enough transparency. Laura Townsend is its director, and she is with me. Stephen Dalton is the Chief Executive of the NHS Confederation, and he's on the line. Laura Townsend, it's the sort of thing we are hearing. Is this what you were expecting?
Well, I think it's a lot worse than we were expecting. We've found that there are plans across England to change and close NHS services to cope with the fact that the NHS just doesn't have enough money. These are concerted attempts to close financial deficits. They're part of a set of plans that are due to be initially signed off this October, but so far have received very little public or political scrutiny.
Well, we're getting that now, aren't we? I mean, we're beginning to get some details now, aren't we, from the Nuffield Trust and so on?
We are beginning to. I think a key concern is why it hasn't been quite this transparent up until now. And that's exactly why 38 Degrees members have crowdfunded for this expert investigation and analysis of the plans.
By whom? Who's going to do it?
So the analysis was done by health policy experts in Incisive Health, and it took a very comprehensive look through all the publicly available documents to piece together exactly what is likely to happen. So there are a few quite worrying proposals across the country. So take Hertfordshire and West Essex. There are plans to reduce activity in the NHS to save £27 million.
Meaning what? Reduce activity? That's a bit vague.
It is vague, and I think that's quite alarming to patients, isn't it? So our analysis indicates that is likely to mean some service cuts, but I think the key thing is these plans are due to be initially signed off this October, a matter of weeks away. So plans to reduce activity, plans to consolidate services, plans to find efficiencies seem much too unclear for the rushed nature of these plans.
Stephen Dalton, do you agree with that?
Good morning.
Morning.
So the process that's taking place at the moment is about local leaders working across health and social care. For too long now, we've either focused on the NHS or we've focused on social care. And when in fact, for someone in need, for someone who's elderly, for somebody with a mental health problem, they need us to organise packages of care across a single package of care across health and care.
Yeah, but we should have been doing that for a very long time, shouldn't we?
Well,
and now we're faced with these cuts, and we don't seem to know, at least if Laura Townsend accept what 38 Degrees says is happening, we don't really know what is going on.
Well, I think there are two elements to this. I don't think we should characterise this entirely as about cuts. Undoubtedly, there is significant financial pressure on the NHS and social care services. However, there's significant demand that's growing. In the first quarter of this financial year, we saw over 5 million attendances at A&E. This was a 6.3% higher than the same period last year.
Yeah, no, I don't think anybody would deny that or accept that things have to change. But you say we shouldn't characterise it as being about cuts, but let's be realistic. That is what people worry about. If their local hospital is going to lose a lot of beds or even perhaps close down, if one of their GP surgeries is going to be closed down in a town, that's the sort of thing they worry about, and quite right too.
I think that people rightly are worried about something that they care about greatly, which is the NHS and social care. But we do need to open up an honest debate. For too long, we haven't been having that debate, and I'm afraid that in parts of our country, the provision of health and care facilities, the way in which they're organised, can be more an accident of history rather than a plan for.
You mean a hospital that we might have needed 50 years ago but don't need today, for instance?
Well, the debate about closing things and moving things generally generates an enormous amount of anxiety, and for that reason there is a reluctance on the part of our political leaders. There's often a very complicated arrangement that we have to go through in order to address those things, and so dodging those issues has become something which has been going on for too long now.
Right.
And our local leaders across the NHS and local government are not drawing up plans to indiscriminately close services.
Well, no MP is prepared to face his or her constituency and say, we're going to close your hospital. I mean, they just won't do it.
Well, I think some MPs will do it, actually, and I think increasingly with engagement with MPs and a better understanding of what's coming towards us in terms of demand, we do need more courage. But so local leaders, what they're doing is they're working together to address the question of how to maintain essential services in the face of massive growing demand.
But the trouble is we don't even have a timetable. Well, let's ask Laura Townsend about that. Do you have any sense of what the timetable is?
Well, the indications we have so far is that there's initial sign-off coming from Jeremy Hunt and NHS England this October. There may be consultations planned after that, but I think if I was a local person faced with what seems like a done deal, that would seem like a rather hollow consultation.
But are you able to say, as we speak, based on what you have found, your investigations have found out, that a hospital in a district is going to be closed, or lots of beds are going to be closed down, and surgery is going to be closed? Are you able to be specific? And are you saying they are actually hiding that from us?
So the straight answer is no, I can't be specific. This was the clearest analysis we could do of a set of very unclear documents. I think Stephen's right, though, that the essence of these plans could be very positive. Of course, it's a good idea to plan services around local areas rather than around institutions like hospitals. But the key thing that I think we're missing in this discussion so far is that these plans come with a firm requirement handed down from NHS England and Jeremy Hunt to reduce local NHS deficits. And what this analysis shows is the reality of that for patients. And the reality of that so far looks like A&E closures and cuts in beds.
Right. And would you accept, Stephen Dalton, that we should be given more information about those proposals as soon as possible?
I absolutely agree with that, and that is the plan. So there are 44 local discussions going on, and those 44 local discussions, we have to put something in front of local communities. We can't just go out there with a blank piece of paper and say, what should we do? We'd be failing in our duty as leaders if that's what we did across health and social care. So we'll be going to our communities with plans about how do we organise health and care together with the community, not in isolation, but together with the community. That is much better than having a single plan in NHS England in London.
Right.
So those 44 conversations are going on right now, and soon will be transferred into a conversation with the wider community.
Stephen Dalton, Laura Townsend, thank you both very much.
Thank you.